Alright guys, so in this video I'm going to go through the bones of the skull that I want you to be familiar with, and also the parts and processes of the skull that I want you to be familiar with. So I have two skull models here that I'm going to use. One of them has some nice coloration to it, so you can see separation between the individual bones a little bit better. So I'll be switching back and forth in between these. But let's start with the first bone, which is the frontal bone. Now, if you guys remember your regions, regional terms that you went through, the frontal region is right here in the forehead, okay? So this large bone, it's all colored in yellow here, that is the frontal bone. It's a very big bone, makes up the frontal region of the skull, all right? So that's the first one. Then we move down to the nasal bone. Well, if you remember where the nasal region is, you should also know where the nasal bone is, right? It's actually a pair of bones joined together, all right? And so you can see them right on the bridge of the nose there. They're in this kind of white color here. Then we move to the maxilla. Now the maxilla is your upper jawbone. So it's colored in purple here. This whole purple bone right here is the maxilla. Okay, that's your upper jawbone. And then the lower jawbone is missing from this model, but it's called the mandible. So in this model, I'll show you guys, you have the mandible, right? Which just fell off. So this is the mandible here. And there's two little foramen that I want you to be familiar with on the mandible, and they're called the mental foramen. So if you remember correctly, the mental region is the chin, right? So this whole bone is the mandible. Remember, mental region means chin. Well, these two little holes on the mandible are called the mental foramen, okay? A foramen is typically a hole or an opening in the bone, and so we'll talk about a few of those. All right, then we move back up to the top, we have the zygomatic bone, which is essentially the cheekbone. So those are colored in this whitish color right here. They help form the prominence of the cheek. You have one on either side, right? And you can also see that in this model. So there's one zygomatic bone here, and the other on the other side, okay? Then inside of the eye cavity, we have a few openings that I want you to be familiar with. So let me see if I can get a good view of this. Now you'll be able to see the fissures really clearly, okay? You have two fissures inside of that orbital cavity, and those are called the superior orbital fissure, which is this large crack here. That's the superior orbital fissure. And then you have the inferior orbital fissure, which is on the bottom, okay? It's a little dark, it's kind of hard to see here, but it's this large fissure on the bottom of the eye socket. And then if you look in the very back, it's a little difficult to see, and they don't have it hollowed out in this model, but it would actually be a perfect hole right back here. It's called the optic canal, okay? And what that is used for is, out of the back of your eyeball, you have a nerve that exits out of it called the optic nerve, and that nerve has to pass through your skull in order to make its way to meet up with the brain. And so it passes through this optic canal, okay? That's right where I've got this pointer. It's sitting on that optic canal. It's kind of a perfect circle that they have drawn in there, but it should be hollowed out. Let's see if this other model has it hollowed out. Yeah, so you can see it a little better in this one. You see how the lighting is. So way back in the back, you get the pointer in there, we've got the optic canal. It's a hole, right? Now it's a little dark in there. It's a hole in the very back of the eye cavity. All right. Now we're gonna move to a lateral view of the skull to go over these next bones. So we're gonna start with the parietal bones. Now those are colored in green in this model. They're very, very large. They're gonna make up most of the lateral aspect of the skull. So you have they're paired. So you have a right parietal bone and a left parietal bone. Okay, one on either side. And they're joined together by a suture, which we'll get to in just a second. Okay. Then we have the temporal bone, which that's this one that's colored in this kind of brownish color here. So if you think about temple region, that's where your temporal bone is. Okay, so you have paired ones of these as well. You have one on the right side, one on the left side. That's the temporal bone. Then on the back, we have our occipital bone. That's this large bone colored in blue here. Remember, the occipital region is in the back of the head. Okay, so that's where your occipital bone is. Back to the side, this bone that's colored in this bright red color, that's the sphenoid bone, right? Sphenoid bone. So be familiar with that one as well. Okay, it's in between the temporal bone, the zygomatic, and the frontal bone, right? Sphenoid. And then when you look inside of the eye socket, right, this is a little difficult to see. You have the small bone right here that I don't want you to worry about, but the one right behind it, colored in yellow here, that's the ethmoid bone. All right, so make sure you're familiar with that one, the ethmoid bone. All right, so now let's talk about two processes coming off of the skull. So underneath, if you look closely at the temporal bone, there's a big fat process right here called the mastoid process. All right, this one is the mastoid process. Now you can't really see the styloid process very well in this model, but let me grab this one and I'll be able to show it to you a lot better. And move that mandible out of the way. So you have mastoid process is this large fat one here, and then this pointy one, this little skinny one sticking off, is the styloid process. All right, styloid process. Now up above the styloid process, we have an opening in the skull called the external acoustic meatus. Well, if you think of the word acoustic, what does that make you think of? Usually sound, right, or hearing. So that is that hole kind of right there where the ear would be located, next to the skull, okay? Then let's talk about the sutures. So sutures are essentially joints in the skull that are connecting two bones together, okay? So let's start with the first suture, which is the coronal suture, right? That is this one that runs in between the frontal bone and the two parietal bones. So it separates the frontal and parietal bones. It's the coronal suture, okay? This next one here that runs right down the middle of the skull and separates the two parietal bones, this one's called the sagittal suture. If you remember correctly, sagittal section is one where you cut the body into right and left halves. So you have a sagittal suture running right down the middle, cutting the skull into right and left halves. On this lateral view here, we have a suture separating the temporal bone from the parietal bone. Right? That one is called the squamous suture. So that separates the temporal and parietal bones. And then on the back, we have a large suture separating the parietal bones from the occipital bone, and that is called the lambdoid suture. So that's this joint joining up the parietal bones and the occipital bone. Okay. Then there are two structures underneath the skull that I would like for you to be familiar with. So looking at an inferior view now, this large hole in the base of the skull, right? This hole is used for the spinal cord to enter up and join up with the brain. It's called the foramen magnum, right? Foramen again means a hole. The word magnum means large, so this is a large hole in the base of the skull. And on either side of that hole, we have little joints, right? These are little points of attachment for the first vertebrae. These are called occipital condyles. So there's one right here and one right here, right? Again, those are points of attachment for your first cervical vertebrae, your C1 vertebrae. And so those are going to be used for the skull to pivot on the vertebrae in order for you to be able to move your skull around, right? So that concludes all the parts of the skull that I wanted to go through with you guys. If you have any trouble with that, please email me and let me know.